And now to talk more on cancer and what Nigeria is doing, we have Professor Usman Malami Aliyu, the DG and CEO, National Institute for Cancer Research and Treatment. Many thanks for joining us, Prof.
Thank you for having me.
All right, talking about cancer, we seem to be having increased number of cancer cases even among children. What's responsible? Is it type of food being consumed, lifestyle? What exactly is the problem?
Also, thank you very much for the question. The actually increase in cancer could be actually multifactorial. If we can look at it from the two angles. One, it could be an increase due to change in the social habits, the way we live our own lifestyle. Things are actually changing. We are imbibing the Western way, of lifestyle as against what we were used to, culturally. Now, if you look at our lifestyle currently, we have more people smoking cigarette, ingesting alcohol, more people taking in alcohol. Sedentary life is much prevalent now than an active life, as against what the active life that has been used to be the predominant way of lifestyle, in the past. The way we eat too matters, people currently imbibe like taking a lot of fatty diets, taking a lot of red meats, and actually so on and so forth. Buying food from maybe the KFCs as against, eating healthy, taking a lot of vegetables and so on and so forth. So if you look at it from that angle, the changing in the lifestyle of an individual or the Nigerians or the Africans as against what we are used to, from what we inherited from our forefathers, that actually contributed a lot to the development of these cancers that we are actually seeing. If you look at it, okay.
All right, you say lifestyle is responsible. Of course, the world is changing and people are also adjusting. But in terms of screening, where are we, in that regard, in terms of diagnostic centers and, screening centers, just to make sure that people can know their status on time?
All right. So, I've mentioned just only one part. The second part, the increase could be due to the increase, screening services, increased awareness of cancer that we have in the communities. So that means now when people are more aware about cancer, they will tend to present, more to healthcare facilities, seeking care or seeking one or two things in the country. So if you have more screening facilities, more screening centers in the country and programs that are ongoing, then you have to prepare, because definitely the numbers that you are used to having is going to shoot up, and you have to make preparation. So it's an interplay of these two factors that I'm mentioning. Now today, if I don't know whether you watch our program, in the afternoon, the Honorable Minister for Health and Social Welfare has launched screening centers, in the country. The federal government, the Federal Ministry of Health and Social Welfare has, through the NICRT, has established 8 cancer screening centers within...
Bringing the total to how many in the country?
Well, currently that is what we know. Initially, in the past, we don't used to have screening centers or what we call the preventive oncology clinic situated within the hospitals. We have them in some private hospitals and some, pockets of screening programs that are being carried out by NGO, but to have a dedicated preventive oncology center, actually it has never happened in the history of this country. This is the first time that we are having a full complement of cancer screening centers in the country. So the Honorable Minister launched 8 screening centers virtually in the country that we have that are well distributed in 6 geopolitical zones. He launched the one in Jabi, and if you have watched the launching, you can see that we have a mammography machine, we have an ultrasound, a colposcopy machine, and so on and so forth. So this preventive oncology clinic were meant to actually serve the people who are seeking information about cancer guidance. They can be guided often, and from there, if they want to be screened, they can also have the potential to be screened, whether male or female in the country. This is the first time it's happening, and we have to commend the Renew Hope agenda of Mr. President, that is His Excellency Ahmed Bola Tinubu, for bringing these services closer to the home of Nigeria.
All right, fantastic, Professor Aliyu. Because of time, we need to round off this conversation. Let's talk about research, which your institute is supposed to handle, and of course, it's fundamental for diagnosis and treatment. Are we doing anything in that regard?
Research?
Yes.
Well, of course, we've been doing so much, in the area of research. The institute, since inception, has been collaborating with local and international partners to actually bring out new modalities through which we can improve the kind of care we give to our patients. And this cut across from research in the area of cancer prevention, in the area of diagnosis, in the area of cancer treatment. We have a series of research ongoing. One that always stands out is what we call the cancer genome sequencing, and that what we are currently doing is to actually identify those cancers that drive those genes within a patient that drive the common cancers that we are currently seeing in the country. And the 5 common cancers in the country are breast, prostate, cervix, colon, non-Hodgkin's lymphomas, and even liver, depending on the site. So these common cancers we are targeting to actually take some samples from the patients within the 6 geopolitical zone and identify the defective genes and the drivers of cancer in this 5 common cancers within the country.
All right. In other words, your institute is doing the needful to ensure that there's enough research, as far as cancer is concerned, just so that we can bring care closer to the people. Many thanks, Professor Usman Malami Aliyu, DG and CEO, National Institute for Cancer Research and Treatment, for joining us on News Extra. We hope to have you some other time, and of course, we want to hear the success stories from your institute.
Thank you for having me.
All right. So now